Dr. Axe here.
Hi folks, Dr. Binner. And say, Dr. Axe, I think it would be really valuable for us to be able to talk about what's called the CBC and Comprehensive Metabolic Panel. If you've had your blood done recently, all the doctors will do those, okay? And we do those as well. And one of the reasons why we do it is not necessarily for the same reason a medical doctor will do it. Okay.
Absolutely.
A medical doctor will look at Comprehensive Metabolic Panel and CBC to be able to diagnose certain conditions. And we look at those too because we don't want to ignore those. But what we do is we look at some little nuanced things that we see within the nooks and crannies of the CBC and the Comprehensive Metabolic Panel. So how about I talk about red blood cell?
Yeah.
Okay, and how about you talk about white blood cell?
Yeah, because we really want to teach you guys, there's some amazing information. Your doctor said, hey, everything's normal, you're fine. When in reality, there's some hidden information in there. And so let's start with the red blood cells.
Sure. Well, let's talk about that, how we look at it a little bit different. Okay, number one, again, we look at narrower ranges.
Yeah.
Okay, and medical doctors, there's not to disparage them, they're looking at wider ranges because they're looking for pathology, we're looking for dysfunction.
Yeah.
The way that I describe that, doc, you probably heard me tell a patient, you know, the healthier you are is when you're going down the middle of the road. I don't want you to go through the ditch and through the gate and to be 2 inches from the cliff before I say, hey, let's turn that car around.
Yeah.
What I want to do is I want to make sure that when you hit that gravel, we get you right back to center. So let's go to the CBC, RBC, red blood cells.
Yeah.
So there's many things that we can check with the red blood cells. So if red blood cells are too low, it can be a sign of anemia, as you know. But there's certain aspects of that red blood cell. It's called MCV, mean corpuscular volume, which means size of that red blood cell. If it's too big, it can mean what's called macrocytic anemia, which means they're getting way too big, and a doctor will look for that. But if they're getting larger than what their optimal level is, that can be an indication of methylation problems. Like we talked about homocysteine. So if I see your MCV starting at a little bit high and I see your homocysteine going a little bit high, that's two correlative factors that you may have a methylation problem that will be totally overlooked.
Yeah.
Then what will happen is in that same CBC, we'll see what's called RDW. RDW is the variation of the size of those red blood cells. And so if we see the MCV go up, homocysteine go up, and the RDW actually go down, that is a third indicator of methylation problems. And if you have methylation problems and it's not detected, and we're trying to get that patient healthy, you're not going to detoxify properly, your liver's not going to function properly, your brain's not going to work properly. So to detect those type of things is very important.
And what can people do to correct that?
So first of all, we always start with lifestyle, right? We want to get nutrition and lifestyle and stress and so on and so forth. But when we have methylation issues, if you ever look at a vitamin, you see B12 and you see folic acid, okay? And if that's what you just see, cobalamin or B12 and folic acid, I think you would say that's a paperweight for your desk, right?
Yeah, exactly.
Okay, because folic acid comes from coal tar, it's mostly synthetic and so on and so forth. When we have every one of our patients, even before we do blood tests on them, we will give them vitamins that are going to be methylated. Because 30 to 40% of the population are going to have methylation problems. And if we see those correlations of the findings that we talked about, oh my gosh, that means that we were making the right decision in the first place. But in that situation, we actually have to increase the methylation. And then we also have to decrease the oxidation in their body. Okay?
Absolutely.
So go ahead.
Yeah, let's talk about white blood cells a little bit. That's our immune system. There's so much autoimmune disease out there. So that's our body's fight against viruses, bacteria, parasites, allergens. So, you know, if that becomes elevated, normally you're fighting something, okay? 5 to 8. So anything over 8, we start to think your body's fighting something. Anything under 5, we start to think, hey, your body's chronically been fighting something. You know, maybe you don't have some crazy bacterial infection, viral infection, but you might have some overgrowth of bacteria, some viruses, kind of hiding out in the body, wreaking some havoc. And so you want to get that load down.
So if you see a person that has low white blood cells, and you think that they've been fighting something for a long period of time,
correct,
what's going to be happening in their gut?
Oh yeah, their gut's going to be down, because the gut, again, dysbiosis has been chronically fighting things. So now the immune system in your gut, your first line of defense is down. It's weak. It can't fight anything. Now you're more likely to get exposed to more things and have more problems.
That's right. And then it can lead to adrenal stress because your adrenals are going to always have to fight that hidden battle. And so, awesome.
So let's talk about the comprehensive metabolic panel.
Okay, this is one of my favorites because there's
Yeah.
a lot of hidden nuggets in there.
Yeah.
We talked about it in a previous video about alkaline phosphatase. Again, it's in your intestinal tract, it's in your liver, it's in your kidneys. And again, medical doctors look for when it's highly elevated, see if there's any type of pathology within those.
Yeah.
Alkaline phosphatase is very important for us to be able to know if there is. It's a very strong indicator for zinc deficiency.
Yeah.
Okay, so if we have a person that has a viral load, okay, and has white blood cells down, okay, and then we start seeing alkaline phosphatase low, well, we know that zinc most likely is going to be an issue, one of the tools that we need to replete in their situation.
So what does that need to be? Above 50?
As far as alkaline, it has to be above 70.
Above 70, okay.
Yeah, and you knew that, but thank you for asking that
yeah.
question. But it also going to be vitamin C.
Yeah.
Okay, it's just one of those things. But now this is the key thing, because a lot of people will say, all right, I'm going to throw in a bunch of zinc. Well, we can't do that. We have to find out to what significance that zinc deficiency is, because if we just throw willy-nilly zinc in there, that can cause a copper toxicity.
Yeah.
Okay, so what we have to do is we have to make sure that we actually, I guess what I'm trying to say is the body never works as a solo act. The body always works as a symphony.
Yeah.
AST, ALT, you want to share those?
Yes, those are liver enzymes. Doctors monitor that. Hey, we're giving you medication. That medication is going to damage your liver, and if it damages it too much, we might have to reduce it. Okay, so that's normally why they use it. We look at it to see how well is your liver working, and the pathological range is what, 32, 34.
Yeah, pathological range,
Right.
but as you know, we go in optimal ranges, so we
Yeah.
always kind of want to see it in the teens.
In the teens, yeah, under 20. Idea. So you could be 25. Hey, it's not out of range, but you really want it under 20. And if your liver, right, if you have gut issues, small intestine, maybe SIBO, any kind of gut dysbiosis, that's going to push into your liver. Okay, and now those liver enzymes can go up. And then if the liver backs up, it's actually going to back up into the kidneys. And then that's when your GFR, glomerular filtration rate, will go down. Now, most doctors don't bring that up until it's under 50%, right? So if I see anything under 80, I'm actually starting to be concerned and say, hey, your kidneys are actually being affected.
So let's talk about as long as we're on AST and ALT.
Yeah.
So you and I both know that it's not only the levels of them individually, okay, but because AST is in higher concentration in different tissues, like the bile duct and the gallbladder and the heart. If we see AST elevated but ALT not an issue, that means we're looking more towards gallbladder and some other things. But if we see ALT increased and AST, then usually it's going to be a liver issue. I mean, that's where we're going to actually look and put things together. And this is where the pieces of the puzzle come together. So if we have a female that has hormonal disruption, gut disruption, and we just start seeing the liver, what is one of the major organs in the body that's going to be able to help regulate estrogen metabolism and detoxification?
The liver.
The liver. Okay, so if we have a lady that is peri or postmenopausal and they already have imbalances of their hormones, their gut's not healthy, and we start seeing imbalance in that liver, and because the gut's not healthy, that's backed up, liver's backed up, and we don't address those, and we just start trying to address the hormones, we're going to fail that patient.
Yeah, exactly.
Yeah, so because we haven't gotten at the root cause. And so what we want to do is we want to look at everything. We want to look at the gut, we want to look at the liver, and then we want to look at the hormones. And as you know, we'll be looking at the adrenals at that time.
Yeah.
Right? So
right here we can say, hey, do we need to focus on the gallbladder more, the liver more? Are the kidneys a problem? Are we seeing some kind of nutritional deficiency? So again, we're getting some great information to lay a good foundation for hormones or anything else you need after. Any other key markers that we should hit on?
let's go through here. Well, we can go to bilirubin. You know, so when we're talking about bilirubin, we're talking about, we won't get into too much, but conjugated, unconjugated. Yeah. And so if we're looking at conjugated issues, then we're looking at more liver congestion, more biliary obstruction, and so on and so forth. If we're looking at unconjugated, that's getting into a little bit more of a medical issue, right?
Yeah.
A little bit more of cirrhosis, some disease of the liver that's going on. So Dr. Axe both look at those to be able to figure out, all right, do we have a functional issue or do we actually have something that's going to have more of a disease flavor to it that we have to bring in the medical doctor for?
Right. And we need to rule those things out, but a lot of times it's just, no, hey, you need to go ahead based on these markers, really work on that liver, really work on that gut. Or, hey, no, that looks okay. You should have a bunch of deficiencies that you need to fill in the gaps. So again, that's why a CBC and a CMP, these are markers that you need to look at that your doctor said, hey, no, they're within the range, they're normal, there's nothing you can do. Right here, there's vitamins, and it can really help guide you in the right direction.
Let's talk about one thing, as long as we're talking about the liver and we're talking about the gut.
Yeah.
Okay, and this is where good intentions can lead to bad results.
Yeah.
Let's say that a person's constipated.
Yeah.
How often does that happen, right?
Yeah.
Okay, they're only having one bowel movement every other day or something of that sort. But then when they've been talked to by their doctor or saw a webinar that they're toxic.
Yeah.
And they go and do a liver detoxification. And let's say they do it right. They do phase 1 and phase 2, but that gut is not working properly. Okay, you are not going to be successful in treating that situation. As a matter of fact, what's going to happen is you're going to actually self-toxify yourself. You do not want to release some of these toxins out in the general population if the body can't get rid of it.
Yeah.
So that's the reason why Dr. Axe and I will talk about time and time again that what we have to do is we have to do things in proper sequence. And so if we don't have that gut migration proper, okay, and the elimination process going proper, one of the last things we want to do is do a major liver detoxification. We have to get that gut going proper. And going forward.
It's like I want to clean the kitchen, but the drain's clogged.
That's right.
You got to unclog that first so that the toxins can actually get out.
Amen.
And when you got to work on the gut, because that's how your body's pushing stuff out, and then you can move on to a detox once you have those systems working better.
Amen.
So I think that's good. Thank you, guys.